New report shows a 10% drop in the amount of opioid prescriptions dispensed over the past year in the state of Wisconsin. While doctors are excited about the progress, they say the opioid epidemic is far from over. News 8's Mal Meyer is here now with more on what the report means for patient care.
Mike, the numbers come from the Wisconsin Prescription Drug Monitoring Program, which keeps track of any opioids and controlled substances prescribed by doctors. Providers say there are many reasons why there's a decline in prescriptions, and they hope to build upon this progress. There's been a lot of change since Sherry Olson started practicing medicine nearly 30 years ago.
When I first went through training, we never prescribed opioids.
That changed in the 90s.
Untreated pain was considered an epidemic.
Doctors started prescribing opioids for non-cancer related pain conditions.
So we've really seen the pendulum swing as we've seen the harm these drugs have done.
Providers are now required to enter all prescriptions for opioid and controlled substances into one system.
We're technically supposed to check the prescription drug monitoring program in the state to see if anyone else has been prescribing these medications.
This can also prevent people from mixing narcotics or sedatives with opioids.
Those two together, it increases your risk of death from narcotics substantially, so it's important for a provider to know where you're at with those.
These doctors believe the decline of prescriptions being issued around the state can be linked back to provider education, including alternatives.
Both drug techniques like other medications that aren't opioids and also non-drug techniques like yoga and weight loss.
Eberline doesn't believe this will take away from care. Rather, patients will be safer and have better treatment methods.
I think in the end, I think patients are going to be getting better care than they were 5 years ago.
The Prescription Drug Monitoring Program system is starting to have information from law enforcement available to providers. It can alert medical staff that a person has overdosed or when somebody died from using a narcotic drug. Mike?
Thanks a lot, Mal. The doctors say it could still take a few years to see further decreases in the amount of opioid-related overdoses and deaths.